All right. Can you introduce yourself at the tape?
My name is Astra Taylor. I am a writer and occasional documentary filmmaker, and I am a co-founder of the Debt Collective, which is an experimental union of debtors.
And I'm Lindsey Muniak. I am the lead medical debt organizer with the Debt Collective, which means I build power with debtors nationally to take on the healthcare system that traps us in debt. And we believe that people shouldn't have to go into debt to access basic public goods.
Would you look at that? So do we. I really appreciate y'all making some time to join us today and looking forward to this conversation. One of the really powerful things that you all have alighted upon is that there are forms of debt that just simply shouldn't exist, right? And it is not until we address the systems that create the debt in the first place that we can think about that world. But of course, the people who are most affected by it have already been hit by that. So can you tell us a little bit, Astra, about the idea behind the Debt Collective and this sort of notion of being able to bring people together around the issue of their collective debt and take on the systems that put them there?
Yeah, thanks for that invitation. I mean, the Debt Collective is, as I said, an experimental union of debtors. The idea is that individually, our debts overwhelm us. They make us feel ashamed. We are struggling, but when we come together with others, then we can fight for changes. And we believe that these debts are a systemic problem and that systemic problems require systemic solutions. So we're not fixated on debt as an end in itself. Our point is that we're in debt because we are denied the means to live. We're denied the public services that we should be able to access. So we have medical debt in the United States because we do not have a system of single-payer healthcare. People are overwhelmed by student loans because there's not a system of free public college. People are putting up their groceries and their essentials on payday loans or credit cards because the minimum wage in this country is $7.25 an hour. So we're in debt by design. And so we take inspiration from the labor movement. We take inspiration from civil rights organizing, from tenant organizing to say, oh, is there something here? Can we, like so many movements before us, turn our insecurity, our shame, our, struggles into solidarity to demand change? So we think we can bring new constituencies into the fight on different issues, but on healthcare specifically, because it's going to take a lot of folks. So, healthcare workers have been organizing for a long time. People who are generally, in the Democratic coalition have been organizing for healthcare reform. And we think that, obviously patients have a role to play, but so do medical debtors, because medical debt is something that sticks to you after your interaction with the healthcare system. So our idea is that there's some strategic potential here and a way to kind of expand the coalition to fight for something that should be so basic, which is just the ability to get care when you're sick without having your financial life ruined.
Lindsey, I want to ask you because you've been working as an organizer on the medical debt side. And, when I was director of Wayne County's Department of Health, Human and Veteran Services, one of our key goals was to erase medical debt for our 300,000 residents who held medical debt. We ranked 8th among all counties in the country in medical debt when we took that on. But one of the things that I think has been weaponized against people with debt is this idea of shame. That the reason you're in debt is because you made irresponsible decisions in your life. And well, you just gotta pay the consequences because you were so irresponsible. And I know, and and all of us know, and I know most of our listeners know that when it comes to medical debt, that's like ridiculous. When it comes to most forms of debt, that's ridiculous. But when it comes to medical debt in particular, right, it is absurd to think because, of course, the minute you step into the system because something's not feeling right, the monetization process of our healthcare system begins. And oftentimes you can't even opt out of it if you wanted to, so long as you don't have your own knowledge about how to care for yourself. So literally the minute you step in for that first diagnosis, you're captured. And if you don't have the means to pay, like you simply did the thing to try and protect you or a loved one from your medical debt. Can you walk us through how you talk to people in a moment when you're having an organizing conversation that gets them past that first hurdle of shame? And folks don't want to self-identify as somebody who holds debt because that's been the narrative in our society has made that such a shameful thing.
Yeah, I mean, this is really a question that gets at the core of what one of the things that we try to do at the Debt Collective, which is take this place where people are most alienated, where people feel frequently most alone, squeezed economically, reluctant to let their family members frequently know that they're struggling with debts that they can't pay because they're concerned about burdening those other people in their lives, their children, their partners, their parents, or even just feeling this sense that they've created a situation that they should have anticipated, that they should have been better prepared for, that really is something that they should feel guilt about. And so one of the ways that we like to bring people in past that initial reaction of shame, of guilt, that impulse to sort of like be very, very alone with your debt, is by bringing people actually into the same space as other debtors, right? And I'm here, Astra's here, we're both debtors ourselves. I had health crises in my 20s that meant that I racked up about $24,000 in credit card debt, paying for medical bills with a credit card. At this point, I know not to do that, but talking to people from the position of someone who's also indebted, who's also known that kind of squeeze, in many ways, like most of us still know it, even if we've navigated certain student loan relief programs or not. But talking with people from that place and starting out by sort of saying, look, this is a system that is designed to make you feel like you've done something wrong. You haven't done anything wrong. You've sought healthcare when you were sick. And the fact that you now have these bills rolling in, these debt collectors calling, sometimes these threats of wage garnishments, lawsuits, like this is not something that you should feel ashamed of or embarrassed by. This is something that the system really should be embarrassed by. It's a failure of our institutions. It's a failure of our state to guarantee people's basic needs. And I think it's really important to sort of like help people redirect the understanding of where the quote unquote guilt lies in this situation. I mean, this is something I have a background in labor organizing. Astra mentioned that we borrow some things from the labor movement. One of the things that you do when you're trying to organize workers is sort of help them understand that their frustrations at work aren't the fault of their coworkers. They're not just some sort of like amorphous series of constraints that they're bound by, that actually, if they look up the chain of management, they can see places where people are making decisions that are hurting them. And we do something similar with debtors, right? Is sort of help people tease out where in the decision-making process of our institutions, of our government, this decision is made, or series of decisions, really, as we all understand, I think, that produces the situation that traps them in debt, that often for people who aren't in debt just creates an intense fear around even approaching the healthcare system, which of course, when people postpone care, their illnesses worsen, or things that would be treatable become untreatable or advanced acute conditions. And so really, we try to kind of build in some political education into the very kind of process of connecting with someone who's in debt, someone who's struggling with a bill they can't pay. And ideally, at some point very early in our encounters with debtors, we'll also connect them with other people who are navigating similar situations to help underscore that they aren't alone.
Yeah, I think it's worth noting, and this is taking a page from the anarchist anthropologist David Graeber, who was one of our dear allies in the very beginnings of the Debt Collective. He's since passed away, but he would always point out that in other languages, for example, in German, the word for debt literally means guilt or shame. So those associations run really, really deep. So, one simple thing we do at the Debt Collective is just try to challenge the language we use. So we never speak of debt forgiveness. We always speak of debt cancellation, debt relief, debt abolition, because we don't want to reinforce that phony morality that says you did something wrong when in fact it's the system that's broken.
Yeah. And one of the ways that the system is broken is that it hides behind a number of labyrinthine technical ways in which debt can be moved and costs are incurred. And so a lot of folks who even approach the healthcare system trying to get care actually don't know how money moves in the system. And so they don't necessarily know how best to avoid debt, and then also how to handle it if it comes and it hits them. And it's that like opacity of the whole system. You guys have done some work in Maryland in particular around trying to step into that morass to bring both clarity and also address the system. And I know, Lindsey, you led some of that. I'd love to hear a little bit about how you came to the policies you wanted to push, and then what ultimately came of it.
Yeah, I mean, this goes to a fight that started, I think, 6 years ago now or so in Maryland, that originated as part of a fight against Johns Hopkins Hospital in particular, for their practices of systematically trapping patients in medical debt and then pursuing them quite aggressively in collections with lawsuits and so on. We were sort of brought to this fight by the fact that National Nurses United, the large nurses union, had uncovered Johns Hopkins medical debt lawsuit practices and the number of lawsuits that they were filing against some of Baltimore City's poorest residents, and then sort of teased out that data and looked across the state of Maryland, and started to look beyond Hopkins too, and saw this pattern of hospitals, which in Maryland, because of the unique healthcare financing system that we have, actually get additional government subsidies in order to provide care for low-income patients. But we saw that those subsidies weren't actually making their way back to the cost of patient care, and that patients who were clearly qualifying for what are called financial assistance programs, sometimes called charity care programs, basically healthcare financial support that the hospital covers for low-income patients, usually under a certain threshold of the federal poverty line, that they were finding themselves hit with lawsuits, that the hospitals were pursuing wage garnishments against them, putting liens on for the patients who in many cases the only wealth that they have is wealth that comes in the form of homes that they inherited from parents. As property prices go up, that's all a lot of people have in Baltimore in particular. These hospitals were requesting liens on their homes. And so because so many of these patients were clearly entitled to this financial assistance, we took that as the site of where we wanted to sort of start the policy fight, ensuring that patients would be introduced to financial assistance options when debt collectors started to call, and ideally before debt collectors started to call, and coming at that absolutely horrifying, just like slew of lawsuits that we were seeing filed against patients, coming at that directly and trying to put a stop to it.